David Napora can barely walk, and yet he feels like he's getting the runaround. The West Kelowna man suffers from a rare form of disease called cerebellar ataxia. On a bad day, he can barely walk, but on a good day, he can handle life, but only with the help of medical marijuana.
My headache is going away. Matter of fact, it's gone. In a couple hours, I'll be up and outside.
But David needs a lot of medical marijuana to get him through the day, about 15 grams, and that's where the problem lies. While applying for his medical marijuana certificate, his doctor, at the advice of Health Canada, will only grant him 3 grams a day. They're fighting that ruling, making countless calls to Health Canada, but no answer.
And now we're still waiting. We're getting the runaround.
And yet David knows that others with similar medical conditions are getting what they want.
There are people that I know that are on over 20 a day, 20 grams a day.
Meantime, when the medical marijuana runs out, like his pain, the level of frustration with Health Canada builds.
Right now, I feel like put my fist through the window.
Rob Callaway has a master's degree in psychology and health from UBCO and helps run the local Compassion Club in Kelowna. He's been following David's plight. He says that when it comes to issuing medical marijuana exemption cards, Health Canada is dropping the ball.
Sometimes, even currently, they'll tell you it takes 8 to 10 weeks to get your application processed and have your card sent to you. But in reality, it's taking anywhere from 4 weeks in some cases, all the way up to 8 months. And this includes even if you're terminal. So unfortunately, some folks actually die. They die before they actually get their Health Canada cards. And this is totally unacceptable.
Despite David's plight, believe it or not, he's actually ahead of the game when it comes to access to medical marijuana. Take Jason's case. He was recently diagnosed with terminal cancer, and he's been shut down by the system. Jason Gilbert has prostate cancer that has spread into his bones. Barring a medical miracle, he's going to die. But he doesn't want to die in pain, and like David, he relies on medical marijuana. But his doctor refuses to sign the paperwork, citing insurance reasons and fear of losing his license. So, out of fear of losing his doctor, Jason is not pressing the issue.
The doctor does support me in being a member of the Compassion Club, which I find kind of unusual. He recognizes that I use marijuana for medicinal purposes and that it works for me, yet he won't sign the federal exemption card for me.
Ironically, Jason's doctor is prepared to prescribe a more potent and highly addictive drug.
Though I can get as much morphine as I want. Yeah, the doctor told me I can have whatever I want. Those are his words.
David and Jason, 2 patients who say they're being victimized by a medical system that would appear to be slow or unwilling to adapt. In Kelowna, Kelly Hayes, Castanet Media.